When someone has seizures or epilepsy, you do need to think carefully about what would you do if you got sick with another illness, right? And that could be any illness. It could be the flu, it could be a stomach bug, it could be anything. And it could be COVID-19, right? So the first thing I really want people to think about is be proactive and have a plan for this in advance. So if you have seizures and are taking medicines for seizures, talk to your healthcare provider about what would I do if I got sick? Are there certain over-the-counter medicines I can take or some I should avoid? And are there certain maybe prescription medicines that are not good? We know that some prescription medicines could aggravate, seizures or might have drug interactions with seizure medicine. So that's the first piece. Now, let's say you are sick. So the question is, and then you start having seizures. Well, some people might actually see the seizures happen before they even know they're sick. They might have a fever or they're having trouble holding down their medicine or not sleeping right. They start having seizures, and then if they talk to their provider or are seen, they find out, well, I've got an infection or I've got something else going on. Now, the other scenario is that you develop the illness, your primary care or an emergency room says you're sick, or in this case, that you're positive for COVID-19, then you want to make sure that your seizures don't act up. So first and foremost is do whatever you can do to stay healthy. Get your rest. If they tell you to rest, rest. But don't sleep all day, because then you're not going to sleep at night and you're going to be sleep deprived. So try to keep a schedule of getting enough rest, also getting up and walking around as long as they've allowed that to you, but getting some good periods for sleep. Make sure you're eating and drinking as best as you can. Fluids are really important in this regards. If you're having a temperature, just using over-the-counter medication, acetaminophen, or ibuprofen are fine to keep down your fever. You talk to your provider if they have a special concern about which one they'd want you to do. Same thing if you have medicines that, because cold, sore throat, there are certain medicines that you should probably stay away from if it could aggravate your seizures. So healthy habits, being careful of what you can and can't do. Keep in mind that with some illnesses, people get sick to their stomach, and then if they vomit, then they can't hold down their seizure medicines. So if that's happening, call your epilepsy provider or your primary care, because they can recommend something to calm down your stomach, and then make sure that you can hold down your medicines, right? So that's another real important thing to do. So in addition to just those things of managing your symptoms, if you've got an infectious disease, stay away from other family members. Try to have a separate room, of your own room where you can be. Use your own bathroom or clean the bathroom in between you and the other person. So, the germs and things like that are not spreading. And that will help you get over your illness better and minimize any spread to other people. So in addition to taking care of yourself and trying to minimize spread to other people, you do want to talk to your provider about what are other ways to do that. So if you're sick, then should you be wearing a mask, particularly in the home or when you're around other people? Should you be using gloves or other ways just to prevent the spread of germs, right? So take care of yourself. Talk to your doctors frequently about the illness, but also managing seizures, and then take care of those around you.